Hello friends, let us now learn some previous year questions in radiology. PGImer 18-fluorodeoxyglucose stands for, obviously it is 18-fluorodeoxyglucose. This is the answer. Half-life of radium is 1626 years. Half-life of radium is 1626 years. 1 curie is equal to 3.7 into 10 to the power of 10 disintegration per second is 1 curie. 1 curie is equal to 3.7 into 10 to the power of 10 disintegration per second. Next, radiation not emitted by cobalt-60 is, radiation emitted by cobalt-60 are beta rays, gamma rays, delta rays are emitted by the not delta, mainly beta and gamma rays. Beta and gamma rays are emitted by the cobalt radiation, only beta and gamma rays. So not emitted are alpha, positron and delta rays are not emitted. In cobalt-60, beta and gamma rays are emitted. Next question, which of the following areas are not examined in FAST? Perihepatic, perisplenic, perihepatic, suprapubic are examined under FAST. Chest and cardiac window, actually these are also examined based on the EFAST, right? So thank you for watching.